Hello and welcome. UVA Speaks is a podcast of Lifetime Learning, a division of the Office of Engagement at the University of Virginia. Lifetime Learning brings the knowledge and expertise of UVA's faculty to the university's alumni, friends, and families. My name is Susan Lynch, and I am the Associate Director of Lifetime Learning at the University of Virginia's Office of Engagement. This podcast features Kelley Anderson, an Associate Professor of Nursing in the School of Nursing at the University of Virginia. As a nurse scientist, she focuses her research on individuals with heart failure, cardiovascular health conditions, assistive technology for patients with heart failure, and innovations in teaching and mentoring. A longtime family nurse practitioner, Anderson also studies nursing in global and under-resourced contexts and earned a Fulbright Program Scholarship to the Czech Republic. In this podcast, Professor Anderson will discuss cardiovascular conditions and her work with rural seniors. So thank you, Professor, for speaking with me today.
Thank you so much for having me.
Great. So first, can you provide us with some context about how common cardiovascular disease is in the United States?
Yes, cardiovascular disease is a very common prevalent disorder. Every year, the American Heart Association releases statistics, and it's usually published annually in the Journal of Circulation. And they provide heart disease and stroke statistics based on U.S. and global data. And basically, about 50% of adults who are 20 years of age or older have some form of cardiovascular disease. And this can include hypertension, coronary heart disease, heart failure, or stroke. And what we also know about cardiovascular disease is that it increases with age. So as we get older, our risk for developing cardiovascular disease is higher. And younger people will be more likely to have hypertension. And then because hypertension is actually a risk factor for other cardiovascular diseases, then older people will have the more complicated forms of ischemic heart disease and heart failure and stroke, which are often related to hypertension. But in the U.S., heart disease and stroke claim more lives than all forms of cancer combined. So a very prevalent condition and one with a big impact on people's lives.
Wow, thank you so much for that context. Those statistics really put it into context. And what can we do to prevent and treat cardiovascular disease?
One of the positive attributes of cardiovascular disease is that there are steps that everyone can take to lessen the risk of the disease. So everyone can really feel empowered to have the best heart health possible by the choices that we make and the activities that we do. Many other diagnoses are less responsive to healthy lifestyle habits. But for many people at risk for or who have cardiovascular conditions, a person can make a very meaningful impact on their own health. So if a person has a condition, say high blood pressure or ischemic heart disease, for example, there are opportunities to lessen the progression and allow a person to feel well with the condition. Nurses are really educated to define health broadly. So a person can have a diagnosis and be healthy, and another person can have no diagnoses at all, but not really be a healthy person. So just because you have a diagnosis of cardiovascular disease doesn't preclude you from being as healthy as you can by managing the condition, minimizing symptoms, preventing the progression, and feeling as well as possible. The American Heart Association does have recommendations to prevent and treat cardiovascular disease. In 2022, they introduced an approach for cardiovascular health called the American Heart Association's Life Essentials 8. So Life Essentials 8 are really what most people would consider basic lifestyle, attributes that you can do, including managing your blood pressure, weight, controlling cholesterol, blood sugar, getting healthy sleep, quitting tobacco, being physically active, and eating better.
Great, thank you. So, as the last thing you commented on, healthy eating is important to consider. So, can you describe to us what is a healthy eating pattern?
Sure. First, we know dietary risk is actually the number one risk factor related to cardiovascular disease mortality in the U.S. These are based on big global studies. For example, there was a study reported in JAMA, the Journal of the American Medical Association, that was looking at the global burden of disease. And it reports trends in different diseases, injuries, and risk factors, looking at comprehensive patterns. So some of the things I described in the Life's Essential 8, like tobacco, glucose, body mass index, but they also looked at kidney function, air pollution, all different factors. And still, dietary risk was the number one factor related to cardiovascular disease mortality. So it has a very big impact on the development of heart disease as well as the progression. So a healthy eating pattern, are things that the body likes. The human body prefers certain types of food, certain types of fuel that are nourishing and optimize our bodies to feel good and function well. The core elements are usually vegetables of all types, fruits, primarily whole fruits, grains, whole grains, dairy products that are fat-free or low-fat, and there's also alternatives to dairy products, including fortified soy beverages, as well as other alternative dairy-type products. Lean proteins, and then healthy oils, including vegetable oils like olive oils and oils in foods such as seafood and nuts. A healthy diet is also one that limits foods that, your body doesn't like so much, including those that are high in sugar, saturated fats, sodium or salt, and alcoholic beverages. There are many diets and dietary products available that we hear about all the time. Sometimes it's very overly complicated and trendy, although it comes down to the fundamentals of good basic nutrition. So that's plant-based foods, including fruits, veggies, nuts, seeds, legumes, and fewer animal-derived foods and processed foods.
Great, thank you for that information. Yes, things that we know, we just need to continue to do that, right?
Exactly. Exactly.
So I understand you are working with the rural community of older adults with cardiovascular disease. Can you tell us more about this work and why you chose to focus on the rural community?
Sure. I live in a rural setting, west of Charlottesville. I love it. The rural areas around us bring such beauty and peace to our whole community. Many people enjoy living in this type of setting, but there have been health differences that have changed over time. In April of 2024, about a year ago, the CDC issued a report highlighting significant health differences that have noted that people living in rural areas are more likely to experience early death from the 5 leading causes than those living in urban areas. And in seniors in particular, our rural areas have experienced shifts in demographics where there's more older people living in rural areas than there used to be. In the 1980s, for example, the rural and urban seniors had similar health outcomes, but those differences in health outcomes have changed over time with rural older adults. And rural older adults now experience higher rates of hypertension, 40% higher rates of diabetes and heart disease, and 20% higher all-cause mortality rates, resulting in basically a lower life expectancy of more than 3 years. In our area, the U.S. Southeast area consistently experiences high prevalence of early death. And according to the CDC, about 44% of heart disease deaths are potentially preventable. So because I live in a rural setting, I love this area and really appreciate the many good things about it. I do care about the other people that live in that setting. And it's not it's a setting that's have a population of people that are experiencing a lot of cardiovascular conditions.
Mm-hmm.
We also know that rural older adults experience challenges that affect their health and wellness just because of place-based factors of where they live. Many live on fixed income. Transportation can be challenging in a rural setting, which makes access to health care and specialty services like nutrition counseling more difficult. There's also the concept of a food desert or with living more than 30 miles from the nearest grocery store, which can occur in the rural setting. And then just, place-based factors of psychological conditions, including loneliness and depression, which impacts healthy eating as well as cardiovascular health.
Great, thank you. I was thinking about the concept of food deserts, and you answered my question there. That's something that a concept that is important for us to think about, and how do we reach communities to impact that? So, thank you for bringing that up, and it's important for us to remember that and think about that.
The other thing about that is a lot of rural settings have low cost stores like dollar store, things like that, that people might shop at, which is fine. There's just certain items that are preferable in those settings over others. So just educating patients about that. One real positive thing about the rural settings is the access to seasonal produce. Like right now, things are starting to grow, and in the Shenandoah Valley we have apples and peaches and wonderful fruits and vegetables that come through this season. So those are real benefits in the rural setting for sure.
Great, yeah, thank you. So, can you tell us more about your work to improve the healthy nutrition for people with cardiovascular disease in the community at large?
Yeah, I've have the real great privilege and opportunity to synergize the work of several amazing collaborators. So we've developed a clinical, community, academic, patient-centered partnership because so many of our processes in healthcare are very siloed. So we've developed a very integrated system that includes UVA, Blue Ridge Medical Center, and the Blue Ridge Area Food Bank, and a national network of telehealth-based registered dietitians. So I'll tell you a little bit about each of our roles. So here at UVA, we have nurse researchers that have designed a rigorous mixed method study using both qualitative and quantitative approaches, and our statistics expertise within the school. In collaboration with the Blue Ridge Medical Center, which is a federally qualified health center which serves residents of rural Amherst, Appomattox, and Nelson counties in Central Virginia. There's about 10,000 patients in the patient panel, and it's the primary providers there are nurse practitioners. The chief medical officer is a nurse practitioner who received her family nurse practitioner degree here at UVA School of Nursing. And at the Blue Ridge Medical Center, it's primary care, behavioral health. They also have dentistry and on-site pharmacy. And then we've collaborated with the Blue Ridge Area Food Bank, which provides charitable food assistance throughout the Blue Ridge area of Virginia. They serve about 100,000 people every month. And with the Blue Ridge Area Food Bank, we've developed at the Blue Ridge Medical Center a food pharmacy. So basically, it's access to fresh fruits and vegetables. And the Blue Ridge Area Food Bank characterizes food according to like a stoplight, red, yellow, and green, where the green foods are most nutritious. And so we have predominantly green foods in our food pharmacy, as well as some yellow foods. And then another component is our network of telehealth-based registered dietitians who are providing our participants with nutrition counseling. And then, of course, our patients are participants. So they're our most important part, or we couldn't make all of this happen. So we have this wonderful collaboration of UVA, Blue Ridge Medical Center, the Blue Ridge Area Food Bank, telehealth, nutrition counseling with registered dietitians, and our wonderful patients. So it's really an innovative, integrated model of care delivery where I really see the whole is much more than our individual parts. It's really the interaction between our components of what we're all good at, but to bring that together to mutually provide comprehensive, holistic support to improve cardiovascular health. So in our study, we're randomizing patients, older adults, 65 and older with hypertension, diabetes, and heart disease, to an 8-week program providing them access to the food pharmacy, a group peer support program, which we call Nourishing Neighbors, where we get together and we talk about food, we make food together, and it's a time for socialization and peer support. And then they have 3 counseling sessions with a registered dietitian. We're funded by a foundation, which allows us to do this work together. Our funding started in January. We began recruiting in February and will go for about 18 months. But basically, we're utilizing food as medicine to provide a holistic way to care for people with the provision of food as well as education and support to improve their heart health.
I'm so pleased to hear about this, the collaboration across all of the institutions. It's just wonderful to hear. And so pleased that UVA is a part of that. So it's always great to hear that.
It is. It's really wonderful to work cross-sector. All of our visions and missions are really aligned, but it's pulling it together and making it accessible to patients in a way that's easy and comfortable for them and in their community and our community that, will really, I think, move the needle forward.
Great. Well, thank you to everybody for doing that work. It's so important. So can you describe the concept? You spoke about this term, but can you describe the concept of food medicine?
Yeah, so food as medicine is actually a really broad term, and it describes a broad range of approaches that promote optimal health and healing to reduce the burden of disease by providing access to nutritious food in conjunction with support. So that could be education support, policy changes, but it's really thinking about the collaboration or the nexus of healthcare and the community. In our particular study, we have the food as medicine as the food pharmacy, the nutrition counseling, and the Nourishing Neighbors classes. Other types of food as medicine are like medically tailored meal programs, medically packaged produce prescriptions, and then on the population level health, it can include policies and programs to improve nutrition and food security. But for us, it's primarily the food pharmacy and the education and the peer support.
Great.
Mm-hmm.
So finally, You've given us tips along the way, but as sort of a final comments to us, what advice would you give to all of us to eat healthier?
Great question. So first, know that not all healthcare providers are perfect in our own eating. Many of us take a class or two, and not actually all healthcare providers take a nutrition class. So it's really the registered dietitians who are most expert in that. So I just say that to let people know to feel comfortable talking to your healthcare providers about your eating and nutrition, and you know just assume that everybody is trying to do better and probably can do better. Strategies that probably work the best are to start to implement small, gradual changes. Your body really needs time, and your taste needs time to adjust. You certainly don't want to deprive yourself and, you know, have challenges with your relationship with food. So usually going from wherever you are now and making some small gradual shifts is the best way to implement change and to have those changes be sustainable over time. And you'll notice that once you start eating in a more healthy manner, then oftentimes unhealthy foods actually become less appealing to you. They just don't taste as good. And then maybe when you eat them, you actually don't feel as well as you used to. But those changes do happen gradually, and that's why sometimes just making these adjustments slowly, work better for the long run. I think another component is that not everybody eats the same thing, and that's fine. Eating is very personal. Even if you're raised in the same household, you probably have very different preferences, and that's fine. That's one of the reasons why in the food pharmacy, for example, we don't prescribe certain things. We allow people to have choice in what they select. So it's important to find what you like and what you enjoy eating. One other thing is a lot of people dine out a lot, and eating healthy can be a little bit more challenging because it's difficult to know all the ingredients that might be in a meal, and then also how that meal is being prepared. So on a practical day-to-day, I guess I would recommend three things. One is to incorporate a vegetable or fruit at each meal. And you can just start by thinking about adding one extra fruit or vegetable each day. And if you miss one at a meal, consider adding one for a snack. And it's basically a 5-a-day principle. If you can hit this most days, then you're minimizing other choices as well. And regarding cost, looking at seasonal ingredients and again, access to the lovely seasonal produce we have in our local area. The second real strategy, I think, goes back to the dining out and trying to spend a little bit more time planning your meals, and that helps you ensure you know what you're eating, and then you don't kind of grab things because you're super hungry. So planning in advance can really help. And then the last thing is just to develop a positive mindset about healthy foods, and being grateful for the foods that nourish you and that make your heart happy and healthy.
Great. Well, thank you. I think that one of your comments about doing this gradually, I think so many times people try to do things so quickly and overhaul something in a broader sense. And if we take these things more gradually, we're more likely to stick with it. I think that's great advice.
Awesome. Yeah, there's a lot of different diets that come out in popular culture and things like that. And, it's fine to give it a try, but usually if you're trying to make a big shift from what you're used to doing, it might work for a short period of time, but it usually isn't super sustainable. Yeah.
Great. Well, thank you so much, Professor Anderson, for this very important information about your work and your research. And certainly, we all need to think about our cardiovascular health, and we can learn from this information and about what we're eating and how we're nourishing our body. I especially appreciate hearing about your work with older adults in the rural and under-resourced communities. So thank you again so much for sharing your knowledge and expertise with UVA's alumni, friends, and families.
You're welcome. Thank you kindly for the opportunity to share our work.
Absolutely.
Appreciate it.
Absolutely. Thank you so much. And I want to thank everybody for listening, for upcoming podcasts and other lifetime learning programming, recordings, and blogs. Please visit our website at engagement.virginia.edu/learn. You can also find out about our podcasts on the Virginia Audio Collective, which is a network of UVA podcasts hosted by WTJU Radio and can be found at virginiaaudio.org. So thanks again, and we look forward to taking part in future lifetime learning programs.